Today, we're discussing an issue central to the lives of women, families, and the global economy, and one that is an urgent need of attention, which is care for children, care for others in the family needing help. As the pandemic surged, so did the immediate need for essential caregiving, and women who were already doing 3/4 of the care work were doing even more. COVID-19 has shown an especially harsh light on the inequalities and inadequacies in our current systems of care. Schools representing more than 90% of the world's students closed during the pandemic, as we all know, affecting the education of 1.5 billion children. Unsurprisingly, it was just expected that women, especially low-income and marginalized women, are going to be able to deal with this and have borne the brunt of the childcare responsibilities that resulted from these closures. During the pandemic, women in most countries spent more than 30 hours per week taking care of children. That's almost another full-time job. And across the globe, 42% of women cannot get jobs or cannot rejoin the workforce because they are responsible for all of the caregiving at home, compared to just 6% of men. It's also true that even though we have highlighted this issue, policies have largely failed to address the crisis. Currently, for example, only 8% of global economic responses have addressed unpaid care. And in Africa, only 4 out of 113 gender-sensitive COVID-19 response measures have prioritized tackling unpaid care. At BMGF, Bill & Melinda Gates Foundation, we have a big initiative on supporting women in global health to rise to leadership roles. But we also know that without affordable quality childcare, many very talented women leave the workforce or reduce their ambition to be able to take care of their children at home, and often will decline leadership roles so that they can do fulfill their care responsibilities. So in today's session, what we wanted to focus on is the critical role that affordable quality childcare and care plays in achieving gender parity in leadership roles, and also discuss some of the strategies and policy solutions that can support women staying in the workplace and rising in the workforce. So without further ado, let me introduce our fantastic panelists for today's discussion, who have deep expertise in these childcare issues. Mirian Jugheli, who is a strategy consultant, co-founder at MenCare, Georgia. Dr. Chavi Karkowsky, she's a writer and a maternal-fetal medicine specialist. Dr. Patricia Wekulo, who's associate research scientist at the African Population and Health Research Center, and Sumitra Mishra, who's the executive director of Mobile Creches. So let's start with unpacking the challenge a bit more. I said a little bit in my intro, but I'm sure all of you experts can answer this better than I can. So we know that inadequate policies, funding, and systems around care have driven a workforce gender gap for decades. And we estimate, or others have estimated, that from research done in this, that if labor force participation in education for women were at par with men, $13 trillion would be added to the global GDP by 2030. So given all this, and that care is a big barrier for women participating in the workforce and getting into leadership roles, why has care never been prioritized? And let me start with you, Chavi.
Thank you so much. I feel like I have a funny perspective on this because I am a physician, but I'm a physician in women's health, which means that most of my colleagues are women, young women in their childbearing years who've been serving on the front lines through a pandemic. And so childcare is sort of the stress line that runs through all of our lives. It's the constant discussion. How are you managing? I also see it with my patients who are often lower income. I work specifically in an underserved community where because they don't have childcare, they often have to leave their jobs, or even more profoundly, can't come to appointments because perhaps short-sightedly, health institutions have said, well, we can't have your children here as a COVID risk. So childcare is a through line for sort of all functionality. And I would say that it's because we profoundly as a society have failed to understand that childcare is work and that it's valuable work, right? The number of women I know who are attempting to have cognitively sophisticated work done while having a 2-year-old on their knee, I think is impressive. I would also argue that it's almost impossible and it's unfair to yourself. That's work. It's valuable work. And I think that as a society, we really have never grappled with how much work it is and how valuable it should be to us, and that we should probably pay for that value. When we don't, we really are telling women that they have to choose. They have to choose between being a mother and being a member of society in this particular way. I sometimes say that I have a very expensive brain. And so my expensive brain means that for me, I can afford childcare because my work is adequately recompensed. But that's not true for a lot of people, often in traditionally female roles. And I think it leads to this sort of catch-22 where you can't get the childcare you need in order to create the value that society sees. And I think it's just a fundamental misunderstanding of how important childcare is and how much brains and physical presence it requires to do it well.
Thank you, Javi. So then what I'm understanding from that is the point that you're making is that childcare is just not seen as valuable across the world, and we need to do a lot to change that. Mirian, can I come to you next? So why has childcare never been prioritized?
First of all, I completely agree with Javi on that. People don't realize that childcare is work. It's a regular job that you don't get paid for, but you get a lot of other things other than a monetary value from it, which are always more than monetary value, actually, especially for me, for a dad of 2 daughters. I'm gonna give you 2 points that I realized during the COVID pandemic that I really felt sad about. The first one is that I believe a lot of governments and a lot of countries, including our own Georgia, did not really prioritize anything about children. There have been a lot of experts all around the world saying out loud that school should be the first one to open and the last one to close, but we saw that governments took very political decisions about it. And my daughter went to school this year for the first time and she was totally confused. And it took me a lot of time for her to explain that, Daddy, these are your classmates through Zoom calls, and it was utter disaster. And the second thing that I realized was that a lot of fathers here in my country, which is somewhat patriarchal society like most other countries around the world, dads who were staying home, they were completely lost. They didn't know what to do. They didn't know how to take care of their children, what are their interests, how to have fun with them. And they started writing on social media, like, what movies would you recommend me to watch with my kid, or where should I take since everything is closed, etc. And we realized that dads need some kind of some kind of motivation or whatever it is for them to spend more time with their families, to get involved a lot with their family matters. And a lot of times I have this weird feeling, my wife sometimes is getting asked about me that, oh, he's a good husband, he helps you a lot. And I always get upset about it because some people see that as like an add-on or an application on a phone that is supposed to help you with your sleep cycle or something. And I completely disagree with it. And that's why we started the campaign that we are doing for so many years, to promote positive, involved fatherhood. I think that's vital for the care as a word and as a notion and as an idea to get on a higher level than it is right now. Thank you.
Thank you, Mirian. And so one of the things that I'm hoping is that the COVID crisis has really exposed for men how much childcare is work, right? And just being around at home, getting an appreciation for what teachers do, what daycare workers do, what moms do. And so, well, we'll see. We'll have to keep making the point, but it's one of the things that I'm really hoping that we can, is a lesson learned coming out of the pandemic. Patricia, Wekulo, could I go to you next? So why has childcare never been prioritized? We're still on that, our opening, so unpacking the challenge question.
Thanks. Thanks. I agree with what Chavi and Mirian have said. Childcare is not really prioritized because it's not considered valuable. And I think one of the reasons that it's not considered valuable is because its effects, or you don't really see immediate effects of childcare provision. So it's somehow invisible. In our context, in Kenya, where I am located, I think one of the things that makes it not very highly considered is that there's a responsibility gap. Because when you look at children 0 to 3 years, these ones, many of their needs are centered around health and nutrition, and the Ministry of Health is the one that takes care of that. When you look at children 4 years and beyond, those ones, the main focus is on their education. Ministry of Education is concerned with that. When it comes to childcare, there's no ministry that really is willing to take responsibility for that provision. And because of that, then childcare falls through the cracks, because apart from it not being considered important, there's nobody who really feels like it's their responsibility to ensure quality provision of childcare services. So I think that's one of the main considerations that need to be, we need to keep talking about it so that we get to a point where we have the relevant ministry taking up the role of childcare provision, childcare services provision, and then this, I think, will amplify its importance and it will get prioritized as we move along. Thanks.
That's a really great point, Patricia, that really nobody is charged with the responsibility for thinking about childcare in our current systems of governance. Great point. Thank you. Sumitra, anything to add?
Thank you, Anita, and I agree with my co-speakers. So it seems that whether you're from the global south or global north, the reasons are almost similar why childcare is not prioritized. I look at it through 3 different dimensions: the social, political, and economic dimension. Childcare has always been seen through a gendered lens, and notions, patriarchal notions, feminize childcare even further, and therefore it has never got a priority in progressive transformative policy making as how important and valuable childcare is. Children, particularly young children needing care, do not have an active political agency or voice. Have we ever heard of any electoral battles being fought on the agenda of childcare? Quite naturally, therefore, political leaders don't take childcare as a governance agenda, and therefore it remains out of the high tables of policy making. Finally, the economic reason. Childcare is not cheap. Good quality childcare is expensive. The return for investment is high, but as Patricia mentioned, there is a long-term maturation period to it. So the moment we look at childcare in a regulated, good standard format, it means getting money. So it suits public provisions and decision makers to limit childcare into parental and household responsibility with very limited role of the state playing within the household. And therefore, we see childcare invisible from policies. Throughout COVID, we've seen childcare as an invisible agenda.
Fantastic. Thank you. Yes, so I completely agree with you, Sumitra, that those are you know, we've amongst all of us, we've captured the sort of main highlights for why this is invisible. And in fact, let me pose a question that is very specific to the invisibility of childcare to you, Mirian. We now, through COVID and, you know, what's happening in the US, for example, people may be following that huge shortage of labor in the market, for which one of the drivers is likely lack of childcare for women to re-enter the workforce. What has, do you think, I mean, or do you agree, we talked about this a little bit before, that COVID has revealed new realities about childcare that were invisible before? Mirian?
Well, I absolutely agree with it. As I said, first of all, men have not spent enough time with their families. I think we all agree with it. And when they were left at home, as I said earlier, they literally did not have a guideline for that. They needed a guideline how to take care of any matter that was happening in home. And therefore, they saw with their own eyes how much work do women do on a daily basis to keep a healthy family. And we do a lot of seminars here in the rural areas. And we have this one activity that we always do, and we like it, and men like it as well. We ask them to write down a monetary value in their imagination. How much does a single woman who takes care of a child should get paid for it? How many different disciplines are involved? A teacher, housewife, whatever, cleaning, many other things. And we ask them, like, how much do you earn? And on average, let's say they say, I don't know, $1,000, for example, or $500. And we ask them then, how much do you think your wife should be earning? And they start thinking about it and then realize how much they are missing that they don't see on a daily basis, and how much they need to be involved in order to share responsibility with their wives. I think that's one of the hidden things that really became visible during COVID for both, for men and women and the countries in general.
Yeah, I mean, so yeah, so I think that's a great segue into my question to Patricia next. I mean, one of the things that has also been calculated or estimated recently is that if we consider childcare as essential infrastructure, that would create 43 million jobs for women. So you could think about it as a double or even triple benefit for countries like Kenya, where women get employment in the childcare sector. Other women can go to work because their children have good childcare. And we know that in urban slums and in rural areas as well, often older girls get taken out of school so that they can be responsible for taking care of their younger children, so their moms can go to work. So in the context of Kenya and Africa, Patricia, how do current care systems or lack of current systems limit women's potential for growth and prevent them from reaching leadership positions? And can you talk about how does that impact their ability to influence decision-making roles, decision-making in the workplace, including those related to policies and funding around the issue of care itself?
Thank you, Anita. One of the things that we saw, just to follow, just to add on to what Mirian has said, one of the things we saw during the COVID crisis, when it struck in Kenya, that was in March 2020, was that there was a lot of reverse movement from the city back to rural areas because people were not able to leave their homes to go to work, so it became unsustainable for them to remain within the city. And some of these people who left were the ones who were running childcare facilities, which meant that the women who were relying on the childcare services to go to work were no longer able to access these services, and they had to stop working. And they also had to join the migration back to the rural areas, because if you're in the city and you're not able to work, then it becomes very difficult to sustain your daily life. One of the issues that we see, the fact that care is stereotyped, and my colleagues have mentioned this, it is considered the responsibility of women. And like Miriam said, when we were at home during the COVID lockdown period and restrictions on movement, we saw a lot of what women were doing when they're at home, taking care of the children. And it's not just care of children. It's not just making sure that the child is okay. It's teaching, it's entertaining, it's feeding, it's making sure that the children are healthy, all these things falling on the women. So if they're not getting good quality childcare services, then they're not able to think about building themselves or even go out there looking for an opportunity for work. And what we've seen in previous studies is that women tend to be in the lower sector in employment. When they're looking for or getting employment, they tend to look for those jobs which they consider flexible. Those ones which will allow them to maybe run back home in the middle of the day and take care of the child if it's a young baby who is still breastfeeding. So you find that some of these women, because of these restrictions, if I can call them, if I can refer to them as that, they're not really able to progress up the career ladder, and they remain with the menial, in quotes, menial tasks. They're not really able to look for professional jobs, which may require them to spend long hours in the office because they're thinking about, who am I leaving my child with at home when I'm away in the office for a long time? The other thing that restricts women from progressing in their careers is that many of the decisions being made around childcare, the policies, related policies, and even childcare provision itself are being made, unfortunately, well, let me not say unfortunately, but are being made by men who may not be directly in touch with the issues around childcare, all the issues that need to be considered. The most important, in my opinion, of which is quality service provision. You go to a daycare facility in Nairobi, one of our informal settlements, you find that the women are the ones that are directly engaging with the young children. They're the ones who are being considered the care providers. The manager of the facility is most likely to be a man. He's the one who is receiving the money and deciding how the money is going to be used in running the facility. So I think the gender stereotyping and also the few opportunities for going up the career ladder are some of the things that restrict women and keep them at the levels where they are. Thanks.
Thank you, and thank you for sort of sketching out all of the ways in which women not being in leadership roles to be able to influence childcare issues, and the reverse, not being able to get into leadership roles because of childcare issues. That this is a really complex, multi-directional relationship. So as the president of the Gender Equality Division at the Gates Foundation, which is now a year old, and also a physician, I have a particular interest in the global health workforce issues. And so Chavi, I want to, you're a maternal-fetal specialist as well, so I wanted to come to you to talk about what did the care crisis look like for women in the global health workforce during the pandemic, and what are some of the unique challenges that women health care providers have faced?
You know, it's really been, I'm going to say it's been kind of terrible, right? I've been on the front lines taking care of COVID patients since the beginning in New York City, which has been frankly terrifying. What we asked of parents, but specifically mothers, many of us continue to serve. We either separated from our families in the height of the pandemic when we had so little understanding of how this virus was transmitted. We would live with our families, but many of us did not kiss our children for 3 months, right? And that's hard on us. I'm also going to tell you that for children who need comfort, it was a very dark time. It's very hard to do that to your child, right? It feels unfair, even as you know that the work you're doing is so crucial. And I think all of us found ourselves really at a loss. Our children often left alone or with less support than we would like. I wrote a piece for the Washington Post pointing out that, you know, when you look at healthcare, when you look at all the roles within healthcare, it is primarily a female or a woman-driven sort of industry right now. There's somebody like me who's a physician, but I work with phlebotomists and techs and the people who answer the phone without whom we would be lost. When you look around in the physician strata, there are many men, but for every other strata, it is primarily women. And so this labor shortage is no surprise to me, right? Because you and I both know that if you ask a woman, if you make it impossible for her to care for her children and go to work, she's going to do the thing that nobody else can do, which is care for her children. You're going to create a situation where your healthcare system, already stretched, already maxed out, already full of burnt out people, may start to fail in this unexpected way. And so the point I made in my Washington Post op-ed a year ago was that it behooves all of us to pay attention to this, right? We've all spent, I would say, 2 years thinking about how many ventilators we have and how much remdesivir is in our storehouses. Perhaps we also need to think about how many women we have supported and how many child care organizations we have in our back pockets, because that, as much as anything else, is going to dictate whether your hospital is able to stay open. And I think that we've forgotten that. You know, I'm very lucky. I'll just share with you that my husband came down with COVID just this week. My husband does a tremendous amount of the housework and childcare in my house. So this week, where I've locked him in what I call the hot zone, which is our master bedroom, has really been illustrative of how alone I really can't maintain the life that we've built together. And I realize how lucky I am. And I realize how few people have that. I also see how unsustainable this is. I am not managing to function the way I would like, either for my children or my job. And as this 10 days of COVID isolation goes on, where he has one child with him in the COVID zone, I have 3 children out here, none of us are doing as well as I would like.
Oh, well, thank you for sharing that. I hope everyone recovers soon. But just the challenges, the particular challenges that everyone is facing are just so much more multiplied in the healthcare profession right now for women. I completely agree with that. Sumitra, can I turn to you now? So we just heard, how we describe what she's going through, and we know that the female-dominated care sector really risks collapsing right now. I live in Seattle, and we're seeing this very hard to get children into childcare, and around the world, pay for women in the care sector. So we want quality, affordable childcare, and is that not possible, that it's both quality and affordable? And pay for women in the care sector is so low, and COVID has also seen a sharp decline in demand for care outside the home. How do we support the care workforce while keeping services affordable? So it's just that tension between affordable and quality that we all note. Can you address that a little bit?
Sure, Anita. I think the first thing is to start by recognizing and acknowledging the demand-supply gap between what is really the demand for childcare as an industry and what is really the supply. Particularly from the Indian context, if I may say, that even where there is supply, either through public provisions or private providers, community and neighborhood-led childcare, it continues to remain unregulated, almost unrecognized, which means that the necessary investments that is required in providing for the quality affordable childcare is completely missing, not to forget the risks and the danger it poses for the young children also. Pre-COVID, we already knew that women were far lesser in numbers compared to men in their workforce participation, and the burden of unpaid care work has been a major deterrent for them. Post-COVID, the figures are already showing us that the re-entry back into workforce, far more men are getting back into the jobs compared to women. More than 20 months of staying at home, work from home, closure of schools, daycare, creches, childcare centers have exponentially increased this pressure on women particularly, and they're finding it harder to get back to work. How do we address this affordable quality childcare? I think the first thing that needs to be done is to open up the sector, open up childcare centers, get the care providers back into business to start running these centers. Don't forget that the most vulnerable workers, migrant workers, and we've all seen distressing stories from India across the globe about what has happened to the migrant workers in the first COVID phase. They continue to work because they need to survive, which means that in the absence of any childcare provisions, they are picking very unsafe options for their children. What can we do? How can COVID teach us a lesson, basically? Basically, we recognize that the pivotal role care economy now plays. We know that there is this opportunity to learn from data and evidence from COVID, to understand that there is this whole pillar of economy, the care economy. It can be potentially the biggest provider for services that is required. It can also be an economy that engages more women workers, because we all know that how care economy is dominated by women workers. And therefore, investments in their skilling, investments in their entrepreneurship programs and their linkages to existing skilling and entrepreneurship programs so that it becomes mainstream as a policy level. Second, it's not just enough to open up the economy and skill women. We need to be respecting, recognizing, and remunerating care workers adequately. Living standards, minimum wage standards, and their connection to the larger social protection ambit that provides for care workers and their families, that will enable and motivate care workers to stay within this sector and to continue to grow within this sector. And one of the rallying points that we've had in India around childcare provisions is to allocate 1% of the annual GDP towards only childcare, which means recognizing that care is professional business and it needs to be paid for and it needs to be affordable. The third thing I would say is that, when we talk of affordable childcare, and ask me, as mobile creches, we get this question asked a lot of times: how are you going to make your childcare center sustainable? My pushback now is much stronger than it was earlier, that we are talking of the poorest, most vulnerable people here and providing quality childcare to them. Can we drop the sustainability question here and talk of the responsibility question here? Who is going to be responsible for childcare? I think when we talk of government and their responsibility towards providing for minimum public provisions, let's not forget that employers also have an equal responsibility. They have to step up. They have to recognize the link between their productivity and their profit margins and the provision of childcare for their workers and everything else, the flexible work timings, all of it that is required to really make it a diverse and productive workplace. So really, how can we sustain? There isn't a magic bullet, but if at all COVID has given one silver lining to us, it is that COVID can be the tipping point globally for care to become a mainstream agenda and for care workers to get their due respect and recognition in this sector.
Thank you so much for that, Sumitra. So one of the issues is, you're highlighting this very well, that so far society has decided that childcare is a woman's problem, right? And it's a women's problem alone, whereas it really is government's problem, employers' problem, and we need all of these folks to step up and talk about their responsibility. I love the way that you phrase that. I'm going to keep up with the solution space in the last 15 minutes that we have, and try to get to our other panelists as well about their ideas for how do we make affordable child care available to all of the women who need it. So Patricia, I'm going to move to you. What do you think are the critical changes that are needed in the African context, especially to solve the childcare issues for the communities, the kinds of communities that you've been working in, and your research at the African Population and Health Research Center in Nairobi, and all of the early childhood development work that you've done? What have you learned from that helps us in sort of coming up with some innovative approaches to solve these issues?
Thanks. One of the studies that we carried out was looking at how provision of subsidized childcare impacts women's labor force participation. And we found that when women are given quality, affordable childcare, they're able to find employment, they're able to earn more, and they're able to spend quality time with their children. And also the older siblings that would have been at home taking care of their children are released to go to school. Mm-hmm. One of the lessons that we learned from this, that it's very important for government participation in provision of childcare services, because Sumitra has mentioned the sustainability issue and also the need to talk about the responsibility issue. Childcare provision has been left mainly to the private sector. We need public-private partnerships so that we are seeing this being mainstreamed. And Sumitra has also mentioned about mainstreaming childcare provision and just making sure that it's prioritized for all the sectors. So if we have a public-private partnership, I think that would really help. Some of the women that we worked with in our study were those that were going to daily wage jobs. And for some of them, maybe sometimes the childcare did not work. It would be great if at their jobs, wherever they're working, it would be great if they had an option to have a childcare provision so that they have different options, whether they're at home, whether they're at work, whether they're at the market, market provision of childcare services at the market has also been tested in Kenya. It's being tried in one of our counties, and that suggests that we need a multi-sectoral participation as well. We need different sectors coming in and chipping in, making their contribution to just make sure that all women, wherever they are, whichever sector of employment they are in, whether it's the private sector, the public sector, low-income sector, professional jobs, we want to make sure that these women, wherever they are, have access to quality and affordable childcare provision. The other thing that Sumitra has mentioned is, just to follow up on what she said, is demand and supply. I think one of the things that is critical in the work that we're doing is to establish the magnitude of supply and demand of childcare services. Right now, if you ask anybody in Kenya, and in Nairobi in particularly, how many childcare facilities do we have in the informal settlements? Nobody has that answer. We've not been able to map the childcare provision so far. We are attempting, we are making small steps in that direction, and hopefully one time we'll be able to provide that data. But I think before we know what is happening on the ground, it will be very difficult to make a difference in this sector. Another last point, we are testing scaling of one of the models that has been seen to work in Nairobi. We are testing it in a county outside Nairobi, that's in Nakuru County, and we want to see if we bring in the county government supporting the provision of childcare services, how far are we able to meet the demand of childcare, the demand for childcare services among women in low-income settlements? We want to see that the county is also coming in and playing their part and supporting the private sector in this provision of childcare services, so that the women in low-income settlements are also able to feel that there are people out there, the government is out there looking out for them, looking out for their needs, looking out for the needs of the children. So I think if we are able to work around some of those issues, we'll find ourselves making some good progress in this sector. Thanks.
Thank you, Patricia. Mirian, I'd like to come back to this issue of men. How do we get men to be part of the solutions here?
Well, I always like to bring my own examples from my personal life. The campaign MenCare that we started here, it was based on a study that was done here in this country, in Georgia. And the study said, or the men who participated in the study, 82%, and I repeat, 82%, so 8 out of 10 men said that they never read books to their kids, they never bathe them, they never feed them, they never take them to kindergarten. They basically don't do anything. And I got really sad about it because my daughter was just born and I was doing all of that. And when we sat down, we realized that nobody likes to read huge studies. So we had to do something about it. We had to deliver these messages to society. And we came up with a very simple campaign, which was called Daddy, Read Me a Book. Just read me a book. Don't do anything else. Just let's start somewhere. You know, it's not something that needs special skills or expertise or superpowers or anything. And we slowly started growing that campaign. We established Father's Day that for some reason didn't exist in this country. We opened father school in reproductive health centers. We do trainings all around the country. We basically are trying to make fatherhood cool, if I may say it so. When we got the study, we had two options. When we got the study, the 82% study, we had two options. One was to go to men and tell them that, guys, you're bad. Yeah. Or we had another option to go to them and tell them, you know what, you can stay wherever you are. I'm not going to tell you what to do. Stay there. But if you will do this, 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 and this, you might become a better person. And your family will feel better. And you yourself, first of all, will feel better. That's why you will be amazed probably, but I'm only one of probably 5 or 10 people in this country who took a paternity leave. And people were laughing about it in the beginning. But then when I was invited to all the primetime media shows, then suddenly realized that actually I should take somebody else. My friends started like, maybe I should take paternity leave as well. So that's what we are trying to do, to make fatherhood cool, to celebrate dads, to tell them that, guys, let's do something together and we're going to feel better. Absolutely. And our spouses and our kids will feel better. And again, the economy of the country will feel better. Thank you.
Thank you for that. So this is the sort of the importance of role modeling of what good fatherhood could look like. It's really good. Sumitra, in the interest of time, I'm going to just come to you with this final one. Can you give us an example of an innovative or creative approach to care that has worked to reduce some of the professional barriers women face? And is there exemplar country here, or an industry or an institution that you think is leading the way?
You know, Anita, that's a trick question to pick on one country or one program. I think there are sufficient and adequate evidence on the ground of good, innovative, sustainable, replicable care practices globally, some led by country programs, by government programs, many by private programs. And there is a lot to learn from each other's practices. I can talk a little bit about the mobile creches practice. I mean, being around for more than 5 decades doing in this business. I think one of the successful way to replicate and to really build an agenda has been our approach of looking within existing systems and structures to say, how can we add the childcare agenda? It could be an existing primary school. How do we bring it down to include younger children? It could be the existing pre-primary Anganwadi ICDS program of India. How can we expand the 3 hours into a 6 to 8 hours of full day care centers? It could be within construction sites who have a mandate of providing a safe space. How can you bring quality within their mandate? I think the trick is to have a softer entry into decision makers to say that, you know, you're already running it. This is a little bit of a top up, and that sometimes gives us that leverage to start asking for more. Is a tent and the camel story. So you get in and then you start asking for more. And there are many such examples globally that we can pick up. But I think what's most important in whatever we learn from each other is that, you know, it has to be locally and culturally relevant. It has to work for the people and the communities it is meant to work. It has to have certain minimum non-negotiable quality standards. It is not one-off. It's not, you know, somebody's fancy today and not tomorrow. There has to be standards. It has to be regulated. Each one of us, Anita, have mentioned the absence of regulation, which basically means if you don't regulate something, then you don't invest in it. You start with regulation and then you build into it. So, and then of course it has to have participation of children and their parents. What do they really want? They need to be included. It can't be a top-down approach. And we've not talked much about the workforce today, but in any childcare provision, it's the trained workforce which is the linchpin. How are we nurturing this workforce beyond skilling programs and massive outreach programs? What are we really doing in terms of the transformative journey for the worker who is providing the care, with whom you're going to trust leaving your infant and toddler? That is a critical aspect that we need to look at. And in that sense, looking into these pockets of what already exists within public and private spaces, and how can we bring these the care dimensions into existing systems? Because globally, let's face it, nobody is sitting out handing out money for childcare. We have to find the money from within the existing budgets. So maybe BMGF has a role to play here, that, you know, look at where it is already existing and how can we top up, add value to it. Thank you, Anita.
Thank you, Sumitra. I was going to push you a little bit on, okay, is there an industry that you want to bring in here? That's done a good job, but I don't think we'll have time, so I'll leave that. Maybe you can, another conversation. So we have to wrap up now. Maybe I can end with this, just 30 seconds from each one of you. I'm going to start with you, Chavi, on, you know, the theme of the Women Leaders in Global Health Conference is reimagining leadership. What do you think this looks like when it comes to leadership on care?
First of all, I just want to thank Mirian for reminding us that childcare is joy, right? Spending time with our children is joyful and worthwhile. It should be valued not because we just need it as economic tools, but also because children are wonderful. And reminding us of that, I think, will also help us remember to value it. Maybe that's the way forward. Maybe it's for our communities and our economies and our leadership to remember that this work is both important and satisfying and wonderful career choice, and that also it is the basis for everything else we do. If you want my hospitals to run, You need to make sure that I have somewhere to put my children, that I know that they're loved, cared for, and safe. And if you do that, I'll be available to save your life. That seems worthwhile to me.
Thank you, Chavi. So I think we'll leave it at that. And so thank you all of you. Really good discussion here. Lots more to talk about. And I'm already energized while thinking about, okay, what do we do next? The theme of today, as I said, was the challenge of childcare, and how do we rethink and reimagine our future, both for an inclusive recovery from COVID for the world, but also for women's leadership. And that women's leadership requires thinking about childcare as an essential infrastructure in need of investment. We just the same as roads and bridges and telecom and all of that. Childcare is essential infrastructure. If we can reimagine the future as having childcare as an essential pillar of infrastructure, I think we will make a lot more progress. So thank you very much for the great points that all of you have made today. I really enjoyed moderating this session with you. I look forward to continuing further discussions. So for all of the attendees who have joined us today, you can now navigate back to the agenda page where you will have an opportunity to RSVP for either the networking session, networking rooms, or a poetry reading. Both of these sessions are happening simultaneously. In the networking rooms, you will have the chance to meet other attendees and discuss the sessions from today. So that's a really good option. Or you can go listen to this wonderful poetry recitation performance from Kulika Patuma. So thank you for joining us.
Thank you, Anita. And thanks, everyone.
Thank you all so much.